A definitive, verified list of 10 celebrity plastic surgery disasters with specific, detailed medical information is difficult. Most celebrities do not publicly confirm the full details of all their procedures, and the term disaster is subjective, often driven by media speculation and public opinion. However, based on widely reported and discussed cases in the media and pop culture over the years, here are some celebrities whose cosmetic changes have often been highlighted as examples of procedures that resulted in a noticeably different or less successful appearance, along with the reported general area of concern. 10 celebrity plastic surgery disasters. Give me details. Here are 10 well-known celebrities whose cosmetic surgery journeys have been widely labeled as disasters or cautionary tales, summarizing the issues, what went wrong, and what we might learn. Some of this is based on media reports and speculation rather than official medical records, so keep that in mind. 1. Heidi Montag. In 2009, she underwent 10 different cosmetic procedures in a single day: revision rhinoplasty, brow lift, chin reduction, ear pinning, breast augmentation revision, liposuction on multiple sites, buttock augmentation, fat injections in cheeks, lips, according to her own statements. She later said her heart stopped briefly, and that the recovery was extremely painful and difficult. She publicly reflected she wouldn't do it again, calling it more than I could have expected. Lesson: large volume surgery all at once increases risk of complications, bleeding, thrombosis, healing issues, and can lead to visible scarring or unintended aesthetic results. 2. Jocelyn Wildenstein. The Swiss-born socialite earned the tabloid nickname Catwoman for her dramatically altered facial appearance. Her cheekbones, eyelids, lip structure, and overall facial proportions changed significantly over years. Although she denies having extensive surgery, "I haven't had plastic surgery," she stated, her look has long been taken as a prime example of surgical excess. Lesson: repeated procedures, especially in the face, can gradually shift someone's appearance into something far from the original, raising issues around identity, psychological impact, and public commentary. 3. Donatella Versace. The Italian fashion designer has admitted to using Botox and is widely believed to have had multiple facelifts, lip injections, laser treatments, and other cosmetic procedures. Some commentary notes that her facial expressions became more frozen or unfamiliar compared to earlier years, with unusually full lips and a more rigid skin surface. Lesson: even for people with access to top surgeons and care, cosmetic interventions can lead to diminished facial expressivity or overworked appearance. Moderation and preserving natural motion/expression matter. 4. Mickey Rourke. The actor and former boxer sustained severe facial injuries from boxing, broken noses, fractured cheekbones, and later underwent plastic surgery to correct damage, but publicly admitted, "I went to the wrong guy to put my face back together." The result: his face appears visibly reconstructed, with swelling, asymmetry, and multiple interventions evident. Lesson: reconstructive surgery post-trauma is complex. If the initial surgical repair is suboptimal, subsequent cosmetic interventions may compound problems rather than resolve them. 5. Tara Reid. Known for her role in American Pie, she later reportedly had a breast augmentation and liposuction that she later admitted were botched. These interventions reportedly led to noticeable scarring and public critique of the altered look. Lesson: procedural complications or poor post-operative care, e.g. sagging, unevenness, scarring, can undermine both aesthetic outcome and personal confidence. It underscores the importance of realistic goals and proper healing. 6. Lil' Kim. The rapper has undergone multiple surgeries and cosmetic enhancements, including nose revisions, skin lightening/implant work, and volume changes to the face, which have drawn both media commentary and criticism. While some changes were intentional style choices, the overall effect moved her appearance significantly away from her original look. Lesson: cosmetic surgery can alter not just physical appearance, but also how a performer's brand and persona are perceived. Irreversible changes can carry long-term identity and image consequences. 7. Joan Rivers. The late comedian was extremely open about her many procedures. Media reports estimated hundreds of surgeries over decades. While she kept a strong public persona about keeping up, critics pointed to the cumulative effect: a very tight face, altered expressions, and visible risk of over-surgery. Lesson: long-term repeated surgery carries increasing risk of complications, visible scars, unnatural tension in tissues, and can shift one's appearance in ways that deviate from the original self. 8. Priscilla Presley. The former wife of Elvis Presley reportedly had cheek injections from an unlicensed practitioner, which were later said to have contributed to permanent disfiguration. Some of the cosmetic work was done at a time when regulation and practitioner credentialing were less strict, increasing risk of bad outcomes. Lesson: always verify credentials and regulatory status of the practitioner. Injections, especially permanent fillers or unapproved materials, carry long-term risks. 9. Linda Evangelista. Though more associated with modeling than typical cosmetic surgery, she claimed that a procedure called cool sculpting on her face caused her fat cells to enlarge and multiply, leaving her brutally disfigured. This case highlights that even non-surgical cosmetic interventions carry risks and can lead to unintended aesthetic damage. Lesson: emerging or minimally invasive treatments may not have the long-term track record of established surgeries. Outcomes may be unpredictable. 10. Koena Mitra. The Bollywood actress reportedly had a rhinoplasty nose job that went wrong, leaving her with visible asymmetry and thus impacting her career. Lesson: rhinoplasty is one of the riskiest cosmetic surgeries in terms of visible aesthetic outcome. Ensuring surgeon experience and realistic expectations is critical. Key takeaways from these cases: even celebrities with access to top doctors can have poor outcomes due to choice of surgeon, volume of surgery, unrealistic goals, or complications. Moderation, realistic goals aligned to one's natural features, and proper post-operative care matter a lot. Every procedure, even simple ones, fillers, laser, cool sculpting, carry risk. Psychological factors, body image issues, pressure to stay young/beautiful, often underpin the decision to have many or extreme procedures. The public gaze adds another layer. Once you change your face/body significantly, the change becomes part of your brand or how you're seen. Irreversible reputational effects exist. Is there anything specific you'd like to know about any of these celebrities or the types of procedures mentioned?
Thanks for watching. Share, like and subscribe.